the European Commission a few years ago produced a green paper on health workforce. In that document, they are confronting with the future, with the next future of the European health problems. It means that the age of people is destined to grow. So also the need for care will grow. Mainly there will be a growth of care at home care, territorial care, more than in hospital care. It's growing the number of women becoming doctors. So also they expect a different kind of relation. I mean, part-time work rather than full-time work. Also, for some specialization are not very much appreciated by women, for it mainly the surgical specialties. So also we are facing some shortage of those specialties. It is one fact. In another document, still on the future of health, they expect by 2020 a decrease, I mean a need of doctors that will be bigger than 13% of the real presence of doctors in Europe. So there will be a lack of 13% of doctors by 2020. But we have in Europe the free circulation of people, so we have free circulation of doctors. Therefore, if the working conditions, well, I mean, brackets, working condition in Europe is not ideal in any place because the burnout is growing among doctors all over Europe and so on. But of course, there are places where the conditions are still worse, and the V4 area is an example of them. So if the working conditions and salaries are not satisfying, in the possibility of migrating from some country to other countries where the working conditions are better, it will be a reality. It's already happening like this. I was recently to a meeting, it's called COPIL. COPIL is an association, a kind of European Medical Association. And they are working, and FEMS has been invited to these works, are working about the medical demography. In this case, I propose now, I'm waiting for data, that the COM is the name of medical, is a committee of European Medical Association, to ask every nation what is the number of foreign doctors working there, because you know when you go working abroad, you must register with the local medical association. In this way, also having the number of doctors we have in the country, and we have the number of doctors, of foreign doctors all over Europe, we can understand, for instance, the percentage. Let's say in Italy we have 250,000 doctors, but we discover that Italians working abroad are 10,000, so we can understand what is the percentage of Italian doctors working abroad. So it can be a very important thing, because as far as the politicians, they don't know the situation, they keep on going with the momentary decision and so on. And it's a big mistake, because now we made with FEMS a research on salaries, and for instance, we saw that the salary of doctors in the V4 area, the maximum salary is the same or is lower than the average national salary. Average national salary is the average of workers, peasants, employees, and so on. So the salary of doctors, in many cases, lower, the maximum salary lower than the average. So that's absolutely unacceptable, because it's a suicidal attitude.
Just to comment what you have said, yes, it's truth that workflow and the doctors as well are migrating all over the Europe. But in Western Europe, lack of doctors or missing doctors are subsidized or covered by the doctors from, let's say, V4 countries who are educated and professional. But we have here in V4 problem that our lack of doctors who will substitute our doctors? And the reality shows us that doctors from Ukraine or from Bangladesh or other countries are coming to the V4 countries who do not have sufficient professional education, which is required. This is the danger.
No, that's absolutely true. That's why the behavior of the politicians here in the V4 area, that it's worse than in many other parts of Europe, is suicidal.
Ano.
Because, well, we say usually everybody is more concerned about his headache rather than an earthquake in China. So sooner or later, the people will ask the politicians, will present the bill to the politicians saying, well, what are you doing, boys? Because our health situation is worsening. We must pay. We don't have enough services and so on. So sooner or later, they must understand that within 1, 2, 3, 4 years, they can survive. But after then, there will be probably a revolt of the voters because we are in democratic parties, so the democratic nations, so the people, they go voting. And the health can be one of the main subjects for a political campaign of any kind of opposition.
Yes, healthcare is a topic during the elections, but unfortunately only during the elections. After the elections, regardless of which political party or orientation wins the elections, politicians behave the same.
I understand that, of course, because it's happening in many places. But also, Vanessa, we have the problem everywhere of the age of doctors, not only in Hungary. But if the working situation for doctors is so bad, of course, young people will make a different choice. Rather than becoming a doctor, they will be... Now, in Poland, doctors are changing the job, then going to make another job, not to be doctor anymore. But if a guy coming out from a high school and decides to go to university, it's lowering. In fact, in this, under this point of view, now next week we have a meeting in Dublin of the presidents of the different European medical organization, and the junior medical doctors already made a proposal, and I will sustain it and already sustained it, that in order to favor the entrance of young people into the medical school, that the medical school be free. And the medical student receive a grant during the period of their medical education. I sustain that because we must favor the entrance. Otherwise, we will remain without. But on the other side, the condition, the working condition must be, of course, improved. There's also another problem here, that is the privatization of health. Well, we see two different models. Health can be a public service, health can be an economical activity. Well, in the economical activity, of course, it's absolutely correct that the person who invests in the health activity, they must take care of the balance and not of the services. So if some activity costs more and other activity costs less, so they decide to go in the direction where they have the best advantage. Health like a service, well, you must look at the needs of the people, and irrespective of the costs, you must satisfy those needs. So on the subsidiarity, we can accept that there is some private activity that must be in some way ruled by the government. But we cannot accept a wild market of health system because it will be a big damage for the population. Not now, within 2, 5, 10 years, because they say that times in health are of 20 years. So when somebody decides for a different system, a modification of the organization and so on, he will never see the results, because either he will be retired or even dead, because times in health are very long. But we must, I always say, 20 years from the day we start. If we never start, we can never count the 20 years. So it's very important to start, to decide, and to think about the next 20 years, and after 20 years, what will be happening. From 60 to 65% of the cost of a hospital is in personnel. Staff. It means that our work is a handmade work. So you cannot think of giving a care without thinking about the person is to deliver this care, because, well, the most activity is handmade, is personalized. So if they think to save money, cutting the resources to the personal, yes, of course, you save money, and it's easy. People retire, you don't change them. But the quality of the system will go lower and lower. That's the problem. Nobody, you can remember, nobody up to now has systems. Well, there are some, but, well, there are not systems of evaluating the quality of the results. But as we talking about the results, here I see absence of systemic healthcare reform. The word system. So the health system, like every other system, must be open in the entrance and in the exit. The entrance of the system is the resources put inside, the cost, but also the analysis of needs. If I don't know what are the needs, I cannot modify the system in order to satisfy the needs. The exit of the system is a feedback, it's an evaluation of results. If I don't know the outcome of my system, of course, I cannot modify the system in order to satisfy the needs. When I have a closed system, system goes to entropy, every kind of system. Entropy means the lowest energetical level, maximum confusion of components. So it's what we are facing in many cases in the health system. Also because in the systems where, still in the theory of system, the system where there is the human presence, they are considered excessively complex systems, because the humans, they take initiatives. So it's very difficult to keep under control such a system. But anyway, if we go checking the outcome of a system, we can understand better what we need to do. So we can understand that you cannot have a doctor who is working 36 hours without rest, because the results after are very bad, and you kill people. The results, well, bad quality means essentially three things: appropriateness of diagnosis.
Sorry?
Appropriateness of diagnosis, appropriateness of treatment, and lowering of complications. With this kind of quality, you save money. So the way of saving money is not cutting the number of people or cutting the salaries, but is going toward a better quality of work, because it's the only real way to have a perennial lowering of costs. So the quality means saving money. So, and now I stop. I just want to say just one thing, because first of all, I'm a man coming from trade unions, and FEMS is a representative of European trade unions. I find absolutely unbearable that the highest level of culture inside the health systems that are the doctors, instead of being taken like, come here around the table, let's discuss how can be done a healthcare reform, and they are working in favor of the system, they are punished in that way, cutting, and also with this execution made by the ministry, like they want to do here in Slovakia. I decide bureaucratically that you stop making the doctors for 10 years, because I politically decide that it's absolutely unbearable. And so as a trade union representative, what I think it's absolutely impossible to accept and to bear such a thing.